Mr. Chairman, guests, it's my great honor and privilege to stand in front of you and share some thoughts on what is best in total hip arthroplasty for young, active patient. We have a choices of hard and hard bearing surface. We have a choices of metal or ceramic femoral head against highly cross-linked poly. So what I'm going to do is point out to you on a balance sheet what I prefer based on some evidence which I'm going to present to you. In laboratory testing, hard and hard bearing surface, especially ceramic and ceramic, then the metal and metal were the best. However, noise, stripe wear, chip fracture, burst fracture continues to be a problem with ceramic and ceramic bearing surface, although small, but does occur. Metal and metal has a distinct advantage of being a large size to reduce dislocation rate. However, very sensitive to position, loss of boundary lubrication, and leading to increased runaway wear and adverse reaction. With that background, I will make a case why metal or ceramic head against highly cross-linked poly is a better choice, even for younger, active patient. These are my disclosures, and in this presentation, I'm going to use and describe to you a product which I am one of the designers. So it's your job to discount it appropriately. I'm going to present to you two series of patients. One, which is 17 to 20-year follow-up on ceramic and metal head against conventional poly in young active patient, and second series of young and active patient with metal head against highly cross-linked poly. Both this second group followed for minimum 10 years. We all know that the polyethylene wear, i.e. the conventional poly, is the number one cause of late failure due to wear exceeding 0.1 millimeter per year, leading to osteolysis and loosening. So these are the two series of patients which I'm going to present in young active patient, which already I have told you. So the first series is prospective match pair of patient followed for 17-year minimum between ceramic and metal femoral head against conventional poly. They were matched for length of follow-up and for age, gender, single surgeon series, body weight, diagnosis, exposure, and activity level as defined by UCLA score. Mean age was 54, mean follow-up is 17 years, body weight 178 pounds, equal in both groups, gender predominantly male in both groups. Clinical results according to the Hospital for Special Surgery score, UCLA activity score, and radiographic analysis for osteolysis, loosening, position of the component, especially abduction angle, combined and anteversion, and wear measurement according to Roman method at 1 year and at a minimum 15-year post-surgery follow-up. Posterolateral exposure, non-cemented fixation by RB stem. This stem also I designed and has a built-in anti-torsion of 14 degrees. 28 millimeter alumina head and 28 millimeter chromium cobalt heads. SG2 liner or RB ring lock cup, and the polyethylene in both these is conventional, either sterilized in air or argon gas. The IBRA software was used to measure the antiversion and abduction angle. Roman method was used for penetration of the head in the polyethylene. The clinical results: hospital for special surgery score pre-op 21 increased to 38 and 39 in both groups. 40 is a perfect score. UCLA score was 6 out of 10 and remained so after surgery. Antiversion in the ceramic group was 10, metal group was also 10. There was no difference. Abduction angle 37 in both groups, where our penetration was significantly less in ceramic compared to metal group with a p-value of 0.001. Incidence of osteolysis was similar. However, degree of osteolysis requiring surgical intervention was in 3 patients in metal group out of 33. The 5 patients had a bilateral hips, one on ceramic, other the metal. This is the best control. And 2 revision in metal group, no revision in ceramic site. Here is the example. Patient on the right has a ceramic head, and you could see hardly any wear. On the left, there is a 5 millimeter penetration and arrow pointing the osteolysis and required a revision of the socket. 4 examples of ceramic against conventional poly with minimum or hardly any wear. 2 are here, 15 and 18 years. Another 2 patient, 18 and 19 years with minimum wear. Ceramic head against conventional poly results significantly less linear, has significantly less linear wear up to 20 years of follow-up in this study. This confirms the observation in laboratory testing of Ian Clark, who showed in 2000 that the ceramic wear in the laboratory less compared to metal heads. Therefore, in summary, the wear of the conventional poly against ceramic articulation is significantly less than metal in this matched pair study with a minimum 17-year follow-up. The wear was 0.08 in ceramic and 0.13 in metal group. So at 17 years, there is no wear-related revision in ceramic group. That's the message in this young active patient. Second group of patient I'm going to present is total hip of using metal head against highly cross-link crossfire in young active patient, and perhaps highly cross-link poly against ceramic head may be the best articulation we have at the present to be used for young active patient. Highly cross-link poly developed in 1990 after extensive laboratory testing shows that it wears significantly less compared to conventional poly as shown on this graph. There are 2 ways we make these highly cross-linked poly. One, in the process, we melt it to eliminate all the free radicals, which allows them to oxidize. When you do that, you lose the mechanical property of the poly as shown in one failure of such a polyethylene from fatigue and crack propagation. When you don't melt it, you leave free radicals, which are capable of oxidizing, leading to a white band as shown in the retrieved specimen. An implication are that when there is an oxidation, you could lose the locking mechanism or you could have runaway wear. So we measured the wear and clinical results of highly cross-linked crossfire in this study up to 10-year follow-up in young active patient. It's a retrospective review of a prospectively followed patient, 91 patients, 112 hips, enrolled between 92 to 2002 with a minimum 10-year follow-up, range 10 to 13 years. Patients were young and active, mean age 53, UCLA score of 8 out of 10. All hips were performed through posterior lateral exposure, either by me or my son Amar. We used secure fit stem, secure fit HAPSLA cup, crossfire liner, and 28 millimeter chromium cobalt head. Follow-up 6 weeks, 1 year, 5 year, and 10 year. Clinical results assessed from WOMAC and a special instrument PAQ, which has been recently published. This instrument we designed, it is a patient-administered questionnaire, and it especially assesses how much residual pain you have and how satisfied you are with your procedure. Clinical results also from UCLA and Hospital for Special Surgery hip score, radiographic results for wear, osteolysis, and loosening. Roman method for penetration. 2 independent observers, me and Daniel, looked at the interface demarcation and wear and osteolysis in all these zones of Charnley and Groin. 9 patients were lost to follow-up at 10 years, and 3 patients have died. 2 revision, 1 for infection at 6 years post-surgery, 1 for recurrent dislocation at 10 years. So I'm reporting on 77 patients, 98 hips at minimum 10-year follow-up. Wear data after initial bedding in, which is in the first year, the wear was 0.051 millimeter per year. There were 11% negative numbers, and this is true with all other reported results. They have some negative numbers. So survivorship for Kaplan-Meier is 100% for mechanical reason in this young active patient. Using all causes of failure, i.e. infection and recurrent dislocation, 97% survivorship. WOMAC results were very high, PAQ results were very good, patient satisfaction was very high, mean UCLA score from 8 to 6 because 10-year patient gets older, and mean Hospital for Special Surgery hip score 37, maximum of 40. Osteolysis and radiolucent lines were not observed around acetabular cup or femoral stem. So both sides were osteointegrated. So this is the first report to our knowledge on where a first generation highly cross-linked crossfire polyethylene liner at a minimum 10-year follow-up in young active patients. There are other published reports on crossfire showing low wear rate between 5 and 8 years of follow-up. There are 2 reports on marathon showing 10-year data with a wear very similar to the crossfire data I'm reporting, 0.05 millimeter per year, and others are 0.03 and 0.04. So to our knowledge, no published study at this point on highly cross-linked crossfire in young active patients at a minimum 10-year follow-up. Despite the concern of oxidation with crossfire, we have noticed no mechanical failure or increased wear and or osteolysis or failure of locking mechanism up to 10 years in this young active patient. And these results are very comparable to the best results reported of ceramic and metal on metal, 28 had 2 reports, and the BHR listed here. So you can compare the best published data on BHR and metal on metal 28 millimeter conventional hip. The results are very comparable. So in conclusion, at a minimum 10-year follow-up, with a mean wear rate of crossfire highly crossing poly is 0.05 millimeter per year in young active patient, with a mean UCLA score originally was 8 out of 10. At 10 years, there is no clinical or radiographic failure due to wear. I thank you for your attention.